Hey everyone, welcome back for another deep dive with us. And this time we're looking at something pretty urgent, actually. A measles outbreak that's happening right now in Texas.
Yeah.
And we've got these articles here titled Kennedy Jr. and the Texas Measles Outbreak. And looks like a very similar article here. Kennedy's vaccine stance amid Texas measles outbreak.
Right.
And yeah, things are a little complicated here.
It's definitely a fascinating situation.
Yeah.
You've got this outbreak going on, 159 confirmed cases.
Wow.
One fatality, most of these are among unvaccinated individuals.
Right.
And at the same time, you've got Robert F. Kennedy Jr. leading the nation's health agency, someone who's been known for being skeptical of vaccines for a long time.
Yeah, I mean, that's the thing that really jumps out, right?
Yeah.
So we know from these articles that Kennedy's got this history with the anti-vaccine movement, even started this nonprofit Children's Health Defense, and
Right.
now he's the head of the HHS Health and Human Services Department.
Yeah.
I mean, what kind of impact is that having on his response to this outbreak?
Well, it's interesting to see how he's trying to handle all of this. In a recent Fox News editorial, he called the MMR vaccine crucial,
Okay.
which seems pretty straightforward, but then he also says that the decision to actually get vaccinated is a personal one.
Yeah, it's almost like he's trying to walk this really fine line,
Yeah.
acknowledging how important the vaccine is on the one hand, but then using language like personal choice, which really resonates with the anti-vaccine community.
Exactly. And then on top of that, you've got actions like him canceling these meetings about vaccines and also his efforts to reshape the Vaccine Advisory Committee.
Wait, hold on. What does reshape mean in this context?
Well, basically, it means changing who is on that committee,
Yeah.
potentially bringing in people who might be more aligned with his own personal views on vaccines.
Huh.
And that could have a huge impact on the kind of recommendations they end up making.
So even though he's saying that the MMR vaccine is crucial behind the scenes, his actions seem to tell a different story. Mm-hmm.
It makes you wonder what his motivations are here.
For sure. It definitely raises some questions. And to really understand how big of a deal this is, I think we need to compare it to how people have responded to similar outbreaks in the past.
Right, like in 2019 in New York,
Exactly.
the articles mention that the HHS secretary at the time, Alex Azar, had a very different approach.
Yeah, completely different. Azar came out strong with his pro-vaccine statements. He was very clear about how safe and how effective vaccines are.
Mm-hmm.
But this time around, with Kennedy in charge, the message is a lot more hesitant, a lot more open to interpretation.
So you've got these two totally different approaches to basically the same problem. It makes you think about what kind of impact these different messages have, especially coming from someone like Kennedy in his position.
Yeah, absolutely.
It's not just about the MMR vaccine. Either one of the articles brings up Kennedy's focus on vitamin A as a treatment for measles, like both in his editorial and during an interview he did with Fox News. Yeah, that's another really interesting thing about this whole situation. Kennedy's been talking about how the government's providing vitamin A in cod liver oil,
Right.
which is a good source of vitamin A. But to present that as like the main solution to the outbreak is kind of misleading.
Okay, can you break that down for me? What does vitamin A actually do when it comes to treating measles?
Well, vitamin A can help with treating measles, but it's mostly used in countries where a lot of people are malnourished. You know,
Right.
in developed countries like the U.S., it's not usually the main treatment.
And this is where Dr. Ronald Cook's point of view really stands out. He's the chief health officer at Texas Tech University Health Sciences Center. And the articles quote him saying that people should be careful about using over-the-counter vitamin A because it could be toxic.
Yeah.
That seems like a pretty serious concern, especially with what Kennedy's been saying.
Oh, definitely. Dr. Cook's warning shows how important it is to listen to medical advice that's based on evidence. And it makes you wonder about the risk of promoting these alternative treatments without giving people the full picture.
It's interesting the articles mention that anti-vaccine groups have been pushing vitamin A as a way to protect against measles for years.
Right.
Do you think Kennedy might be playing into that by promoting vitamin A as like a substitute for the MMR vaccine?
It's possible, by presenting vitamin A as the answer, he might be giving people who were already hesitant about the MMR vaccine a reason to avoid it.
So we have this complicated situation where the person in charge of the nation's response to this measles outbreak has a history of promoting ideas that go against what medical experts recommend.
Right.
It makes you think about how that's affecting public perception and how the outbreak is going to play out.
Yeah, it's a valid concern, and it's not just Dr. Cook who's worried. The articles mention several other medical experts, too, like Dr. Mesh Dalja from Johns Hopkins, Dr. Molly O'Shea, who's a pediatrician and spokesperson for the American Academy of Pediatrics, and Dr. Alfred Levy from Boston Children's Hospital.
What are they saying about Kennedy's approach?
They all seem to agree that they have serious doubts about Kennedy's messaging.
Okay.
Dr. Adalja thinks that Kennedy's words, especially when he emphasizes personal choice, show that he supports the anti-vaccine movement to some degree.
Huh.
Dr. O'Shea's worried that Kennedy didn't come out more strongly in favor of vaccines in his editorial.
Hmm.
She really emphasizes that vaccination is still the most effective way to protect yourself from measles.
Mm-hmm.
And Dr. Levy says straight up that vaccination is by far the best way to protect yourself and your community from measles.
So you've got all these experts raising red flags about how this outbreak is being handled at the highest level. What kind of consequences could this have?
Well, when the person leading the charge is sending mixed messages, it
Mhm.
can create a lot of confusion, and people might start to trust public health measures less like vaccination.
All right.
And when people lose trust, they're less likely to follow recommendations, even when those recommendations are based on solid science.
Exactly. And that lack of trust can lead to lower vaccination rates, which can then lead to more outbreaks like the one we're seeing in Texas. It's a vicious cycle.
It really is. And this whole situation highlights the tension between personal beliefs and public health.
Mm-hmm.
People have the right to make their own choices about health care,
Mm-hmm.
but those choices can affect other people too. That they can impact the health and well-being of the whole community.
It makes you think about the responsibility that comes with a position like Kennedy's. He's not just sharing his own opinions.
No.
He's shaping public policy and influencing how people view a serious health issue.
Absolutely. And that's why the situation is so complex. It's not just about science. It's about ethics, leadership, and finding the right balance between individual freedom and our responsibility to each other.
So where do we go from here? We have this outbreak, a health secretary with a history of being skeptical about vaccines, and a lot of conflicting information going around. What's the way forward? It feels like we're at this crossroads, How do we balance individual choice with keeping the public safe, especially when you've got so much misinformation and skepticism around?
That's the big question, isn't it? And there's no easy answer. But I think it starts with being honest and open with each other.
Yeah. Mm-hmm.
We need to listen to people's concerns about vaccines, even if those concerns come from things that aren't true.
Right.
And we have to respond with empathy and with evidence.
So it's not enough to just tell people to go get vaccinated.
Right.
We have to understand why they might be hesitant in the first place and have those tough conversations.
Exactly. You can't just shame people or dismiss their concerns. That's only going to push them away even more.
Right.
We need to create a space where people can talk and feel heard and respected, even if their views don't line up with what scientists say.
That makes sense, but how do we actually do that, especially when we're talking about a disease like measles that spreads so easily and where vaccination rates really matter for everyone's health?
It takes a lot of different efforts working together. Healthcare providers need to be ready to have these conversations with their patients, address their concerns and give them accurate information.
Mm-hmm.
Public health campaigns need to be designed in a way that reaches different communities and takes into account all the cultural and socioeconomic factors that might be contributing to vaccine hesitancy.
Right.
And we have to figure out how to fight back against misinformation online, because that stuff can spread so quickly and really influence people's decisions.
It sounds like a huge task, and while those big picture efforts are important, it also makes me think about what we can do as individuals in all of this.
Oh, absolutely.
Yeah.
Each of us has a responsibility to educate ourselves and to talk about these things with the people in our lives.
Yeah.
Talk to your friends and family, share accurate information, and be willing to listen to what they have to say.
Mm-hmm.
You might not change everyone's mind, but you can make them think twice and encourage them to be more critical of what they hear.
It's almost like we need a whole shift in how we think about vaccination.
Yeah.
Instead of seeing it as just a personal choice, we need to start seeing it as something we do for everyone, a way to protect not just ourselves, but also the people in our communities who are most vulnerable.
I love that way of putting it. It's about realizing that our choices affect other people, and that can be a really powerful thing.
So to wrap things up, we've taken a close look at this complicated situation in Texas where a measles outbreak is happening at the same time that the head of the health department has a history of being skeptical about vaccines. It's brought up a lot of questions about leadership, about how public health messages are communicated, and about the balance between individual freedom and our responsibilities to each other.
What I hope people take away from this deep dive is a better understanding of why some people are hesitant about vaccines. It's not just about being uninformed or stubborn. There are deeper social, cultural, and historical reasons at play.
Right.
And to address those reasons, we need to be open with each other, show empathy, and work together to find common ground.
Yeah. This has definitely given me a lot to think about, and I hope it's done the same for you all. As always, we encourage you to keep learning about this topic, to look at different perspectives, and to have those important conversations about how we can work through these issues together. Thanks for joining us on this deep dive.